Hey everyone, today I want to talk about digestive disorders and how I use homeopathy to help support digestion. So we have to look at a few things here. One, we have to look at the root cause. I know everyone uses that word or phrase, root cause, but we really want to understand what that means. And when it comes to digestive disorders, there are very clear and obvious root causes. And so we have to target those root causes, which I'm going to talk about here in just a minute, if we truly want to heal the gut. Okay, so we have to understand the root cause. And then when we understand the root cause, we have to give the body information through however we're treating it. Like, let's use homeopathy as an example. We have to give the body information that targets that root cause. And if we don't do that, we're not really going to heal the gut long term. Maybe in the short term, it'll be like, oh, my gas and bloating are better, or my constipation's better, or my IBS is better. Then as soon as you stop a protocol, if your symptoms come back, that's a key sign that whatever you were doing actually wasn't touching upon the root cause. So there's a lot of very standard approaches to digestive disorders today. If you go to any holistic practitioner, natural practitioner today, and you go in with digestive symptoms, a gas, bloating, maybe constipation, maybe diarrhea, maybe multiple stools a day, brain fog, right? They're going to say, oh, you have SIBO, right? And so they're going to say, take these supplements, avoid these foods, right? And that's like, and do this test, like maybe they'll do a breath test, and they'll be like, yeah, you have a gut dysbiosis, and here's the protocol. So that's unhelpful, and it never gets to the root of why you have those symptoms. When everybody gets the same protocol, it's a red flag that your treatment really isn't being individualized, and also it's not touching upon why you're struggling with gas and bloating and constipation, because 3 million people in this world can have those symptoms, and they'll need, a slightly different healing protocol. In homeopathy, you can have 3 million people with those symptoms, and, many of them need a different remedy. So we have to, first of all, one, get to the root cause of what's causing the gut dysbiosis. And then two, we have to individuate the treatment. And so let me start with root causes, and then I'll get into how to individuate the treatment and how I use homeopathy to do so. So hopefully, if you're struggling with gut issues, this will make sense as to why you are, and give you a more proactive way to approach your gut issues. So let's just start with root causes. The root causes of gut issues are the same root causes of every other chronic disease today. And for some reason, people in the medical field, whether it's alternative or conventional allopathic, it's really interesting to me that nobody knows what causes things sometimes. In homeopathy, when you understand symptoms and how to read the body, there's never like, I don't know why you have this. I don't know. You always have an answer, and usually multiple answers, as to why someone's struggling with what they're struggling with. It's really not that hard to determine why somebody's struggling with what they're struggling with. So the root causes of all disease, including gut dysbiosis, are suppressive therapies, right? We have these suppressive therapies that target the immune system in a way that suppresses its expression. So when you get eczema as a kid, or when you get cradle cap as a kid, or when you get a fever as a child, then you get sore throat and you get an ear infection. If you get older and you get depressed, you have allergies. Whenever we put a suppressive agent into the body, these are everything from over-the-counter medications to topical steroids, to antibiotics, to vaccinations. All of these things target the immune system and signal to it, stop expressing symptoms, and it shuts down its expression. And it gradually shuts it down over time. So like the kid's eczema goes away, but then the kid develops maybe a cough. And then, oh my gosh, the cough comes with a fever and I don't want it to get into pneumonia or bronchitis. So then the antibiotics are given. So you see, everybody has a story of suppressives, of this ride that they're on with they get this condition, they suppress, they get this condition, they suppress, and so on and so forth, until hopefully one day the adult or the parent is like, oh, whoa, wait, I see that this is causing more harm than good. And so now, not to say that suppressives are never necessary, because sometimes they are, but they're needed far less than we call on them for. Nobody needs a vaccination. Nobody needs a vaccination. It's not going to help anybody heal or prevent any disease. In fact, it's going to cause more problems. It's going to suppress the immune system and set the body up for chronic disease over time. Okay, so when it comes to digestive issues, you see, everybody has a story. You think back and look at, oh, well, I had this UTI, I had this cough as a kid, I had this thing as a child, antibiotics, ear infections, antibiotics, sore throat, antibiotics, right? Oh, these vaccines, I had this many vaccines. And so really, that is the amount or the degree that is overlooked in the cause of chronic disease is astounding. It's like the answer is right in front of us. It's so obvious, but for some reason, we're not really looking in that direction. We're like, oh, okay, well, you have this, take this supplement. A supplement, no supplement on this planet at this time anyway, is strong enough to reverse the effects of suppressive therapies. Suppressive therapies are really, really strong. They're very powerful at suppressing the immune system. And how do we see this? Well, at one point, the child stops getting fevers and just gets sore throats, and then gets ear infections, and those are suppressed. And so then they get acne and constipation and depression, right? And so over time, the pathology deepens with each suppression that is introduced into the body. So, and we know that the entire gut is lined with immune cells. And so whenever we take a suppressive, we're compromising our gut health, okay? And so we're compromising its integrity. We're restricting its ability to actually fight back and heal, because when you suppress something, just think of, you suppress something so much, it's like, tying your hands behind your back while somebody's punching you in the face. You literally can't fight back. And so, so everybody has a unique story as to the suppressives they were exposed to and where they're at with their health right now, okay? Everybody is going to have unique symptoms. So SIBO might be like bloating and brain fog, but homeopathy gets much more nuanced in its understanding of symptoms. A really good homeopathic practitioner is going to be like, okay, you struggle with bloating. What time of the day is it worse? Does anything make it better? Does passing gas or belching make your symptoms better, or are they still the same? So we get very detailed to understand how the body is actually expressing the symptoms of gut dysbiosis. But this whole story was set with being exposed to multiple very strong suppressive agents from a young age, and then your parents were exposed to these, and these things carry over and very much influence our genetic expression. So that's one root cause. Another root cause is emotions. So if we're experiencing high stress, if we've experienced trauma, if we've experienced, if we're highly anxious, all of these things also are going to affect the gut, the expression of the gut microbiome, right? And these are also going to play a big role. So in my practice, I never just take physical symptoms. They're not helpful enough. We have to also understand the person's emotional expression, what emotions they're prone to, meaning what are their triggers. When we can understand the emotional side and marry it with the physical, this is how we truly individuate somebody's treatment. And in homeopathy, what does that mean? It means this is how we get somebody the correct remedy. So we really have to understand all the physical stressors one has been exposed to, such as the suppressive therapies, and we have to understand the emotional stresses that's set the organism off, because some people have different emotional triggers than others. Somebody can get in a car accident and walk away and I'm a little banged up for a few days, and they're fine, and they walk away pretty much untouched by the accident. Somebody else can get in a car accident and they develop claustrophobia, a panic disorder, and panic attacks since that event. So we have to understand what is each person's unique emotional triggers. It's going to vary from person to person. And so to really treat gut dysbiosis, I know it makes logical, linear sense to be like, okay, how do we repopulate the gut, and how do we take out the dietary triggers? That's like your dog shits outside on your welcome mat, and you just put a paper towel over it, versus you go out there and you scoop it up and you clean it and you wash it off and you wash it off a few times, and eventually you get it into where there's nothing left and you have a clean slate, right? So that's what I do from a homeopathic perspective, is that we're going in there and we're getting the welcome mat clean, so to speak. And so the reason we have to approach our gut dysbiosis like this is because you take supplements, you omit foods, but you're never going to touch upon the root of the issue. Those things cannot touch upon emotional triggers. Those things cannot touch upon the suppressive therapies that are weighing your immune system down like a load of bricks sitting on top of it. So we can use homeopathy. This is the main reason that I practice this medicine is because of its ability to go in and slowly, gradually, over time, undo the damage of suppressives and gradually bring the immune system up to a higher level of functioning. So and this is the only way to get to the root of gut dysbiosis. This is the only way that I know of right now, today, until somebody invents something else that actually goes into the body in a non-toxic way and removes the suppressive therapies gradually over time. Homeopathy is very much a slow food medicine. Okay, and think of all the years that shit's been in you, right, all the suppressives, it's going to take time to remove those things. But with each remedy and the time that passes as that remedy works on your organism and on your gut, you're going to gradually get better and better and better, and your gut health is going to get a little stronger and a little stronger, and you're like, oh wow, I'm not having as much gas, I'm not having as much bloating, I can eat a more diverse diet. These are the changes we should see over time when you're given the correct homeopathic remedy. And it doesn't matter what your digestive issue is. If you've had constipation for 40 years or for 30 years, you've had jaundice with diarrhea, or you have a lot of gas or bloating and you look 8 months pregnant all the time. You know, it doesn't matter how long you've had the symptom, okay? What matters is that you get the correct treatment into your body. This is why things like, you know, you'll hear me talk about why I'm not a fan of probiotics and supplements and like strict, rigid elimination diets, because it's like we're just dancing around the problem. I've had major success helping people heal their gut using homeopathy. And I'm talking about everything from C. diff. I used to have a practice that was, when I first started practicing homeopathy, where I was treating cancer and I was treating C. diff independently. And that was like my focus. And the C. diff, if anybody's ever had C. diff or known anyone who's had it, it's such an intense gut infection that nobody knows how to treat. But these symptoms are so extreme and clear that homeopathy is amazing at supporting C. diff. Well, eventually I started treating more and more gut disorders, Crohn's, colitis, chronic constipation, IBS, liver disorders, which often fuel diarrhea and poor gut health. And so, but the whole thing, the disease diagnosis really isn't that big of a deal when it comes to diagnosing. It's actually not super helpful. But what is super helpful is understanding somebody's symptoms. What is the current symptom set, and getting very nuanced about understanding those symptoms. What were the suppressives that you were exposed to? What was the last suppressive you had before your gut got really bad? That's a really great starting place. And then, what are your emotional triggers? This is how I approach all issues, including gut dysbiosis. So if you're somebody who's done all these protocols, spent heaps of money on supplements, your gut's still the same, it's no better, or maybe it's a little better, but as soon as you go off of those supplements, everything comes back, it's a red flag that the root of the problem is not being addressed. And so that's when you may want to consider homeopathic medicine for your gut health. So yeah, and hopefully this helps you maybe think a little bit deeper about your gut health and explore homeopathy for getting to the root of your gut health struggles. See you soon.